our coalition conversation today. Our coalition conversation for today is about nurturing all kinds of families, care partners, caregivers, family members of all kinds. My name is Alice Bonner, and I'm the chair of the Moving Forward Nursing Home Quality Coalition. We're very glad you're with us today. Some of you have been on a number of these calls. Some of you might be brand new to these conversations. We would love to have you chat in your name and affiliation, what organization you're with, or if you're an independent person who's just joined today, that's great. And I am joined by Isaac Longobardi, who is our director, and Sumeri Maki, who is our associate director. They're the masterminds behind these conversations. And we tend to have a really diverse group on these calls. And I can already see by looking around, we have nursing home residents on the call today. We have physicians, nurse practitioners, maybe social workers, people from the quality improvement organizations, and many others. So feel free to put in what your role is, as well as your organization. These calls, if you have not been on them before, the Moving Forward Coalition really tries to keep these informal and conversational. So we will not be using slides today. You're going to hear from three wonderful guest presenters, three people who are part of our coalition. They're very involved in different ways, and I'll introduce them briefly in a moment. And then I'm going to kick it off and ask all of them an introductory question, and then we've got some specific questions for each one of them. So you're going to hear their questions, and again, the chat is open. If you have a question, if you think of something, you want to make a point or write in something, please feel free. And Isaac and Sumeri and I will watch the chat and share the information with our speakers so that they can know what you would like to say. I'll just briefly go back to the Moving Forward Coalition, who we are. We are a group of organizations that has come together to, to promote a vision, which is that every nursing home will be a community in which lives are nurtured, residents are empowered, and where people want to work. And we say that we're going to do that through our mission of bringing the power of diverse voices together now. And so we're very action oriented. We're not a research group. We are really about influencing policy by bringing people together and saying to ourselves, where is the common ground, the common path that we can all agree on and come together, get consensus around, and then how can we bring that forward and talk about that publicly, talk about it with people in Congress, talk about people in the states, and really bring our messages out there. So again, as I'm looking at some of the people on this call, I know you're doing that, and you're going to hear more from our speakers about that. So please be ready to share your stories today as much as possible. And I'll also say one more thing, which is we want to focus on a balanced view, right? There's a lot that people sometimes talk about that can come across as negative or is negative. And I don't think we want to do that. I think we want to say, here are some challenges that we do want to talk about. And also, here are some best practices. Here's some positive things that people have figured out. This is where they've come up with a barrier or a challenge, and then they've addressed it. So again, you're going to hear from three people today who are bringing a perspective as nursing home residents or as family members. And we're going to talk about some of the ways that we can really address family members of any type. They might be a direct family member, they might be a care partner, a friend, a colleague, a neighbor, but people who are really influenced when someone important in their life goes into a nursing home. So with that, I am going to introduce each of our three speakers and just tell you a little bit about them, and you can read more about them in their bios. And then I'm going to start with a question for them. So we have Jeanette Sullivan-Martinez with us today. She is a member of the statewide coalition of the presidents of resident councils in the state of Connecticut Long-Term Care Ombudsman Program. She is the voice for nursing home residents in nursing home reform. She is involved in state and federal legislation. We've called her up some days and she said, oh, I'm off to the State House today, can't talk to you. She gets interviewed by local and national newspapers and public radio. And she's been a nursing home resident since 2008, and she is a proud mother, and mother of 3 and a grandmother. So that's Jeanette. Our second guest is Cindy Napolitan. Cindy, you can wave if you want. Cindy is a nursing home resident who lives outside of Dallas, Texas, and she's lived in 2 other nursing homes over 6 years. She advocates for herself and others, and she's an advocate at the local, state, and federal level, and she's an active participant in the Consumer Voice Consumer Advisory Council, and Consumer Voice is also a member of our steering committee. So thank you, Cindy, for joining us today. And last but not least, we have Carrie Leljedal. Carrie's been an advocate since 1988 when her son, Lynn Ray, was born with a rare seizure disorder, and he has been living in an intermediate care facility for since 2013. And Carrie has always been an essential support person. She is also a volunteer advocate. She became part of the she started the Illinois Caregivers for Compromise program as a state spokesperson and a family advocate. She also works with Illinois AARP, and together they passed unanimously the essential caregiver legislation in Illinois that was enacted into law in 2023. She's on the board of the Great Panthers NYC, and I see Michelle Arnott from Great Panthers is also on the call today. Carrie co-chairs Transformation Tuesdays, and we'll chat in the link for the upcoming program of webinars. And she's a part-time person who works with the Live Oak program as a program manager. So I know that was a lot, but that gives you an idea of who we're dealing with today. So 3 people who know a lot about this topic and have a lot to share. So I'm going to start with a question that is for all 3 panelists, and anybody can answer first here, but we're wondering if you could just start for this group today of describing the relationships that matter most to you in the nursing home. The relationships that matter most to you in the nursing home, and how have your relationships changed before or after you or your loved one moved into a nursing home? So who would like to kick us off? Go ahead, Cindy.
Yes. I think one of the most important relationships as a resident in a nursing home is the relationship that you develop with your hands-on caregiver. For me, that would be my certified nursing aide. If you don't have a good relationship with that person, if you can't communicate, then everything becomes a little more difficult. So I always try to have a personal relationship where I know about their personal life and how long they've been doing this and why they choose to do it. And I think that helps build a better relationship all around. It's also good to have a good relationship with your nurse and the administrators and basically everybody that's involved here. I try to get to know. So the more people that you get to know, your better chances of having a good experience living in a nursing home.
Thank you. Thank you very much.
I will completely agree with her. I think your interactions with your CNAs is extremely important. One of the things that needs to be emphasized in the nursing homes, though, is that they need to keep the same CNAs on the units that they work so that they can build that personal-centered care level of trust that's necessary in day-to-day care. Also allows you to get to know them personally, their families, their life. I've gotten the nickname around here as Mama J because most of the CNAs here are younger, quite a bit younger, the ages of my own children. And they're like, oh, I just need some advice and I just need to talk to you. So it's that kind of relationship that you develop, which allows you to have a very fulfilling experience, and you're not dreading who's coming in to care for you because you've already known them. I agree, nurses is very important. One point she did not mention is, I will say, getting to know your kitchen staff, because this way your kitchen staff gets to know you, gets to know what you like, and if there are changes in the menu, they know you well enough to what you would choose or not choose. So that's what I would say.
Great points. Thank you. Carrie, how about you?
So So my son's been where he lives for 10 and a half years. We're very lucky. This is the only facility he's ever lived in, and God willing, this will be the only facility he ever lives in. My relationship with our facility becomes different because I live less than 2 blocks away. So first of all, I make sure every staff member who gets hired knows where I live. If you have a problem, you need something, stop by. My house is right there. And it's really important to me. That's one of our ways of letting people know I'm involved. And it's not just with our direct care staff, it is with our entire staff. But for me, it's also with our residents, because my son is in an ICFDD and we have a lot of residents that have no family whatsoever. I am their family. They are my family. I refer to where my son lives as our home. We bought a house around the corner for a reason, and it was for everybody. And there's nothing that brings me more pleasure than when I can have 5 or 6 residents and 5 staff members at my house on a Saturday afternoon to cook out because the weather's nice. Or somebody walks one of them over to come play with my dogs.
Right.
So it's, how do you build your family into their family?
Right. That's a great example of the intertwining of, and creating one community like that. So I love how you guys talked about how those relationships change and how you've adapted. I do want to just point out, we do have a couple of people on this call, several people who really work on those relationships and that trust you talked about with CNAs. And Taylor McMahon, of course, I'm looking at you, but there's many other people on this call too. We have Cheryl Huckins from Michigan, and a number of others. So I'll just stop for a moment before we go back to our speakers and say, does anybody want to say anything more about building that sense of family with the nursing home team?
And folks, just raise your hand if you want to unmute.
Hi, Alice. I was so excited for this webinar and this opportunity to talk with all of you. And I have to say, our residents and their family members are our best recruitment and retention effort. We all know money's important, and we try to advocate for our team members to make more money, right? But the reason they stay is because of these meaningful relationships that they build with our residents. So it goes two ways. I know I'm changed professionally and personally by each resident that I've interacted with. So it definitely goes 2 ways. So thank you for sharing.
That's great. Thanks. And anybody else? Taylor's from the state of Pennsylvania, by the way.
I see one question in the chat from Gretchen. They ask, are there many nursing homes in my area use agency nurses? Are there any recommendations on how to have agency staff get to know you?
That is a great question. And I'll see if anybody on this call wants to respond. I know we have a number of nursing home providers and people who are direct caregivers and leaders in nursing homes. Agency nurse and temporary nurses the use of them is up tremendously since the pandemic. So any ideas on how to weave those individuals into the community and into the sense of family? It's a great question.
Talking to them, getting to know them, and say, "Oh, where are you from? How long have you done this? Do you enjoy what you do?" And we all know that they're making more money than the people that are actually in the building. Unfortunately, hopefully that will change come future, but treating them like you would treat anyone else. Because one of the things that I've heard from agency nurses and CNAs is that they get treated like they're the outsider because everyone knows they're making more money. And so then they're angry and upset that they're doing the same job as they are. So treat them the way you would treat anyone else, and they in kind will respond to you.
Mm-hmm. Great advice. Thank you so much for that. That's good guidance. We often think, again, that it's hard because we don't have a regular person who we know who knows us, but they're feeling maybe the same way, being in a different place. All right. I'm going to ask a couple of questions now specifically to individual people, and We'll stop after each one in case other people on the call want to chime in. So Jeanette, I'm gonna go back to you for a moment. And you know, one of the things that we talk about a lot with the coalition is there can be a negative image of nursing homes in the media. You know, there's just often not a positive portrayal of what nursing home life is like. You know, also, you know, people talk about nursing home admission. And when someone comes to a nursing home, what a difficult time it is, especially for family members and people who've been a care partner, again, whatever that relationship is. So again, there's a recent New York Times article that a lot of people talked about and we sent around. You may have seen it. Let me read a quote from that article, a short quote, and ask you to respond. The quote says that putting a spouse or a partner in a long-term care facility for any reason represents a fraught transition for a couple, one that can mean release from the sometimes crushing burden of caregiving, but can also be accompanied by lingering depression, anxiety, and guilt. And that's been shown in studies. And here's a quote. Someone in the article said that everything was on my shoulders for the care of a very vulnerable person, and that stress left when they went to a nursing home. So all of the 24-hour you know, duties could be done by someone else. And, you know, he had been worried that something was going to happen to the person he was caring for, but those worries were really reduced when she went into the nursing home. So do you have any thoughts about that passage based on your experience? And is there anything that you would reframe in that article about, you know, going into a nursing home as a resident?
I made the choice of coming into a nursing home because at the time my girls were both away at school and my son was threatening not to go to college so he could stay home to take care of me. I was in and out of the hospital for a year and a half, like 5 times. So it was approached to me to consider a nursing home. So one of my best friends, God bless her, she went around to all the nursing homes in my region, like where I live locally and my family lived, and interviewed them, did the admissions process and spoke to them and got information. And then I made the decision to come to the home that I am in. I think what was very helpful, is that she was able to give me insight on the building and stuff that you might not get when you first come in to a facility, or I got to choose basically. And sometimes people are taken from the hospital and they don't really get a choice. So I think the first thing is that there needs to be the option of a choice. The fact that the home caretaker feels so much more relieved because their loved one is now in a home, there's 2 sides to that. The stress and the pressure is off of the day-to-day care. So now, once again, if the facility helps them assimilate well, then that person now becomes their loved one again, their husband, their brother, their wife, no longer just their care person. So it kind of alters the way you view the relationship. And so I think that is something that needs to be looked at more from a nursing home perspective. Like, how can they help the loved ones assimilate well? I've been very fortunate to have the rare experience of coming in at a young age and getting to know all different types of families here. But also how my family helped assimilate was just being able to have the stress relieved off of them. And because they were no longer doing the physical care for me, now they could come and sit and have coffee with me and just relax and take me out for a walk and not feel the pressure of having so many other things to do while they were doing that. It now became a more pleasant visit type situation than a painful, hard, feeling guilty type situation.
And that's, you know, so beautifully said. And you focused on the positives for us. You said, you know, these were things that you found that actually worked to help your family members and help the people in your life after you were in the nursing home. We would love to hear from anybody else about things like that, things that you've put in place to make things better with those relationships and to really make it a positive experience, help quality of life, not only for the person in the nursing home, but also for family members. I do see we have some other people on the call who I know have talked about this, and would welcome you to raise your hands and let us know if you want to chime in and add anything to this. I think this is really, really important. We certainly hear from people who say that they're not involved at the nursing home where someone lives that's important to them. They don't have that kind of relationship. And yet here we have an example where it can happen, and it can happen now. It's happening around the country. So I'll
Can I jump in for a second, Alice?
Of course, Carrie, go for it.
So, and because it's my son, obviously my scenario is a little different than most people's, but there's also the other side to that, which is the family member having to learn to give up control. Like I said, he's been there 10 and a half years, and I don't know that I've still actually given them total control. I'm not gonna lie here, but it's a learning process for both sides. It's the care team learning to listen to the family member that has done the care for all those years. It's learning to work together and not against each other. And it's difficult. And like I said, from my perspective, it's harder because I am a mom, and, we all have mom guilt, but, it is so much. One of the things I say all the time, people most of the time don't move into a long-term care because they're choosing to. They're moving in because they're in crisis. So there's that even initial, how do you get that transition so everybody can stop, take a deep breath, and then move forward? Because when you're in crisis, you can't think clear. I mean, I honestly, anybody that was in that working in our facility when my son moved in, the fact that they don't still hate me 10 and a half years later is a miracle.
Yeah, well,
And they don't.
Yeah, right. Well, that's another example. If you've worked hard at that and really tried to, put that together. I was just going to say, Mairead Painter is also with us today. You may know Mairead. She's with the Connecticut
Yes.
Long-Term Care Ombudsman Program, and there she's waving. Hi, Mairead. She does a lot of national work, and she's one of our co-leads for the Moving Forward Coalition on Resident Councils, which we'll talk about in a moment. But I wanted to give Cindy a chance again to talk a little bit about, you and your daughter both live in the nursing home, and can you talk about how you've maintained that relationship and strengthened it over time? How do you support her, and how does she support you?
I'd like to share a little bit about why we both came. We both have the same disease. My husband, her father, was our caregiver, and he suddenly passed away. So we both came together. We've always been roommates. It's 6.5 years now. And fortunately, I do have a family member. My daughter is my roommate, which is, I'm fortunate that we can be together. We, in a nursing home, you spend a lot of time with everybody that lives there. When you eat together, you do activities together. So I was trying to think about this question earlier and trying to see if it's more like living in a dormitory, but it's really not, because you can leave, a student can leave and go to a class and leave for a few hours. When you're living in a nursing home, you're together all day long and all night long, right? So communication is key. Liking each other helps a lot, and having the same kinds of likes and dislikes. And, fortunately for us, it works out very well. I've seen other family members. We have husbands and wives that live together. And then we also have just other people that have maybe the same kind of issues. to dementia patients that help each other out. One might remember how to get dressed, the other one remembers something else. So putting the right people together in care setting is key to them getting along, and being able to help each other out.
Yeah, those are really, really great points. And it kind of brings up for me the topic of roommates and ability to either choose a roommate or get matched with a roommate, and how that can be really challenging in some nursing homes. And people don't always have a lot of choice. And yet, it's really a fundamental human aspect of our lives, who you would share a room with. So I think that relationship with your daughter and you talking about it is really helpful to hear. Maybe we'll go back to Carrie for a moment. And Carrie, I know, one of the things you've shared with us is that, you've got your relationship with your son, you talked about that, but you're also an advocate and you do state, local, and national advocacy work. Can you talk a little bit about how that balance works, and whether you talk about your advocacy with your son at all, or not at all, or what your thoughts are about that?
So the biggest part of my long-term advocacy started because of the pandemic. Prior to that, I've always advocated for my son, but the long-term care part truly did start because of the pandemic. And I could tell you early on, the CEO and our executive director, they were a little scared. They were worried about what was I going to say and how would this make them look.
Oh, did she freeze?
I think she froze.
Yeah.
Probably son lives. I knew everybody was finally comfortable doing when they let me meet with a reporter from Fox News in our lobby with the logo behind me. But it's important, I was not willing to let anybody else's feelings get in the way of my advocacy for what I believe was the right thing to do. My son is very aware of it. So are others in his building, from our staff all the way in either direction. 2 years ago, our facility actually gave me an advocacy award, and that might be the best gift anyone has ever given me, ever. If I can't stand up and speak for not just my son, but for everybody else that's in our building, in our state, if I can't fix this system, I don't understand, somebody's got to fight. And, sometimes it works and sometimes it doesn't, because I'm not, I don't have all the degrees. I don't have all that other history that a lot of people in the long-term care advocacy have. I have the mom. I am the mom. So that buys me a little bit of leeway. Also, at the same time, I can get away with saying things or asking things that somebody else might not, because I am a family member. And, and then you add the mom on top of the family member, and it does make a difference. But I'm proof one person can change it. One person can change this system if we're willing. And we just all have to be willing.
Right. Well, I chatted in, what would it take for us to get every nursing home or every community to have an advocacy award? How often would that happen? And what would it achieve if we did that? It meant a lot to you. It recognized and valued what you brought. And for that to come from the nursing home, that's the thing that makes it particularly special. So I know we have other nursing home residents on this call. I see Marguerite. Hi, Marguerite. Glad you've joined today. And I know we have people from the QIOs, for a couple of them. Carolyn is on, and a few others who work with our QIO colleagues. Happy to have you guys chime in on any of this and any work that you're doing around this advocacy issue. Hey, Carolyn. I see Deb Carmony's on here from Ohio, I think, who's a nurse practitioner and does a lot of work. Again, some of the policy work too. So I'm just naming a few people, but there's others on the call as well. Yes, and that is like a superpower. Somebody chatted in.
Can I comment on something too, Alice? As Carrie was sharing, it reminded me, and I don't know why I didn't bring this up earlier. My grandmother actually lived here for 7 years while I was here. I had come for 3 months and had left for a year and went and lived with my sister in Oklahoma. She was going to do my personal care. After a year, it became too much. And so I came back to this same facility that I had looked into before. During that time, my grandmother had been moved from one facility to this facility because my mother had been so pleased with the care that I had gotten the 3 months that I was here. And so she lived for seven years. So every morning she'd come over and say hello to me first thing in the morning because she could get up and out of bed herself and I could not. And then at lunch, I would go see her right after lunch and I'd sit and watch like half hour of a movie show with her. And then in the evening after dinner, I would go over and sit and watch another half hour show with her in the evening. So it provided us the opportunity to not only continue our own relationship, but to have our own relationships outside of each other. At one point, they had offered her, well, would you like to share a room with your granddaughter? And she's like, oh no. And I said, Graham, don't you love me? What? She goes, you're too busy. She says, I want a roommate who's quiet. You're too busy. So we both got the best of both worlds while she was here. And I saw her on a Wednesday. She walked from the bathroom to her bed, which was the by the window. So it was quite a distance with her walker. And that Saturday evening, she had passed. She had gotten the flu and just wanted to be made comfortable and passed on. But it was a wonderful experience having her here, but having our own separate lives as well.
Mm-hmm.
So I just thought I should share that experience in case someone else has had something similar.
It's a great story. I love how you guys are all weaving these stories about, Cindy and her daughter, Carrie and her son, you and your daughter, your grandmother. These are great. And these are really great examples. In case anybody's not able to follow the chat, Deb Carmody chatted in that she emailed the executive director in DON at the nursing home and she wants to do the advocacy award. So Carrie, you got another
You go.
positive, yay there. And we'll see what happens. But Deb, we're gonna wait to hear back from you after we see what happens. Okay, we got thumbs up. Fantastic. Deb and I got to meet at one of the conferences and she's all about getting stuff done in her state. So Carolyn, you had your hand up. Did you want to chime in?
I did. This has just been such a great conversation. And I love not the assumption that you would want to both live together, right? So that acknowledgement of individuals and really just taking that moment to learn if it's something that would be a positive for both of you. I had a question. I wanted to ask if any of you participate in your facilities quality improvement committees.
I actually help participate in new employee orientation, and I give a patient perspective of what we expect. Like, please knock on our doors, please announce yourself, please wear your name badge. If you move something in our rooms, please put them back. Not all of us have the ability to put things away. Would you be willing to assist us? That type of thing. Gives them a little more friendly way of starting. And what's interesting is most of the time that I do attend those orientations and the new people coming in will always acknowledge me in the hallway. Oh, hello, Jeanette. Like, they're happy they finally met, they have a face or a name that they can kind of relate to. Because I always say to them, if you have an issue, like say for housekeeping, if you're having an issue with a particular patient, would you please come let me know? And then maybe we can talk to them together. It's got to be, whatever the issue may be. And that has really helped and worked. And
Thank you.
So that's great. My son and one of the other residents in our building also do that. And from what I understand, it can probably get quite interesting between the two of them because neither one of them have a filter. So they just kind of really tell people how it is.
Mm-hmm.
But it's important, like my son, we've worked real hard to teach him that this is his home. And it's taken, a lot of years for him to start advocating for himself. But, and that's, I think working the new higher orientations has done that.
Yeah, I think that's absolutely great. And I love how you're bringing out the importance of people hearing the voice of residents. It is not the same when a family member or care partner speaks on behalf of that resident. I tried to do it when I was a family member and I was wrong as often as I was right. And so it's really hard, but I think that's a great point. So I also saw that Taylor chatted in that she's going to be recruiting some residents to help for new hire orientation. Fantastic idea. Start right at the beginning. And I'll say Carolyn, who just spoke from iPro, the QIO in New York and New Jersey, is one of the people who's working closely with us on resident councils in the state of New Jersey. And, just making sure that that voice comes through. And one of the comments back from the residents at some of the resident council meetings has been that they want the new orientees to know about resident council, and they want them to know about the residents and introduce themselves. So at the nursing home where I'm working with the team, they have now decided that on new hire orientation, they will bring the new hires to the next resident council meeting. So very similar, I think, to the ideas that you've got. So really valuable. I will say in the chat, there's a question from Mary about what specifically can QIOs do to bolster advocacy, specifically the advocacy we're talking about today with family members and care partners. And in addition to Carolyn, I know we have Amy Rasmussen, who has joined the call, and other folks who work really closely with QIO, Stephanie Bailey from Rush, and I'm sure others. So would one of you like to talk a little bit about how QIOs work on advocacy with nursing homes? Go for it, Carolyn.
I think it let me unmute again. Okay, I did want to share the reason I asked this question is we are in the process of doing a training on quality improvement committees and that whole process. I shouldn't say, because it's not just a committee, it's that whole quality improvement process for nursing homes. And we're doing a whole segment next month on dedicating a segment to how to engage individuals living in our nursing facilities, care partners, ombudsmen in quality improvement, because sometimes there's a fear of doing that we have to get past and sort of move past maybe just reviewing resident council minutes and actually have people participating in a more meaningful way. And it might not be the whole meeting, it might be parts of a meeting, or it might be a quality improvement project to reduce falls or improve something related to meal service. So that's one way that QIOs are involved, is just working on providing that education to nursing homes on how you can do it and how it should do it as part of your quality improvement process.
Mm-hmm. And again, I'll thank you for that. Anybody else who wants to specifically say anything related to advocacy and family members and care partners? And, part of the reason for asking on this call today is we never want to jump over residents. We don't want to go to family members and care partners instead of going to residents. That would be bad. And we all know that, but sometimes that happens. And so part of talking about it today is figuring out how can we really continue to advocate for the residents and their voice, and do that through resident councils and do that through advocacy awards and things like that. But thoughts on that, Carrie? Go ahead.
So educating people, first of all, what the difference between POA and guardianship, and making sure that people understand that just because they are a resident, they have not lost their rights. They are allowed to speak up for themselves, even when somebody has guardianship, that person is still allowed to make decisions. It's something that infuriates me all the time of, oh, well, we've got to go ask their POA. Really? That's their POA. This person can speak. As long as they can verbalize what they want or need, their voice is who matters, and I'm going to give everybody a really bad example that sounds horrible, but it was a eye-opening experience for everybody in our building. So everyone's heard me say my son has seizures and they're very difficult. So at one point he was refusing an emergency seizure medication and not wanting anybody to give it, all the rest of it. And we knew we had to stop the seizure, but my son can talk during a seizure, which is very unusual. Mm-hmm. So myself and a couple nurses, we gave the medicine. We trumped him. And our executive director came back to us 2 days later and she said, you guys need to realize you violated his rights. He has the right to refuse. And if somebody wanted to push it, the nurses could have lost their license. I could have been charged with other things. And it was a real eye-opening experience for all of us that, yes, even though he was in a seizure and all the rest of it, he still had the right, as long as he could speak, he had the right to do that. The minute he couldn't, yes, the my POA comes in play.
Right. It's a very complicated set of circumstances. And thank you for demonstrating that with that example. And Amy was chatting in about that too. So again, not always cut and dry. Marie, you've had your hand up.
So for caregivers, I just wanted to really give a shout out for family councils and how there can be a fear. We hear about the fear of retaliation and that it's not about having experienced retaliation, right? And it's not about something that has happened. For many people, it's folklore. It's something that they've heard about or once somebody experienced it. And so they go in with this impression. And until you talk to other family members, you talk to other residents, you get that support, it can alleviate a lot of that. You learn how to self-advocate. You learn how to partner in care. And it can sometimes take a lot of that stress away. And so I think when you feel alone, and sometimes even when you're watching a scary movie, if you sit alone, right, you make up your own things in your head. If you have someone with you, it's less scary. And so when you have a resident council, when you have a family council, those are those partnerships where things can be less scary. You can have people who help support you in that, in the choices that you've had to make, and also show you that, you know, they've raised questions or concerns and nothing happened. And it was a good outcome and there were positive resolutions. And I think the more we can encourage family councils and buildings, even virtually, the stronger that support can be for new family members coming in to talk to people like Carrie and other family members.
Yeah, great points. Thank you so much for mentioning the family councils, as well as we said earlier about the resident councils, both really important. Does anybody else have experience with resident councils that they'd like to share, or experience with family councils? Anybody established a family council that there didn't used to be one? Anything like that? Karen Klink, glad to have you. What would you like to say?
Okay, can you hear me?
Yep.
Yeah.
Oh, okay. Well, you know, I mean, I don't have experience with nursing homes myself, but you know, as an advocate, you know, I'm happy to hear that there's so many good experiences. I really am. Like, I don't hear that. Like, people don't come to me because they, you know, they're having a good experience with their nursing home. So I'm glad that all you guys, you know, are having better experiences. You know, I haven't had good experiences in my long-term care. Alice knows, you know, I advocate loudly and sometimes I piss people off, and I'm getting better at it. But you know, I have tried, like I have tried to, you know, I haven't had my mom in a place that had a resident or family council. I have tried to do that. And yes, people seem to be afraid, and maybe they're afraid because I'm organizing it, perhaps, but they seem to be afraid to want to be in a family council. They don't want to rock the boat. That has been my experience, and I just thought I would share that. But yeah. Like I said, I'm glad that, you know, that there are good relationships being formed for all of you that are in, you know, in a skilled nursing home.
Mm-hmm. Right. Well, we started, you know, by saying we wanted to try to find some balance, and your voice and your, you know, comments are really important. I'll just tell the rest of the group, I had the opportunity to hear Karen give a keynote address at a large national conference a few weeks ago, and she was fantastic. And she got a standing ovation at the end. So if you get a chance to hear her speak, it's very powerful. So I'm going to just switch to a few more questions because I see we have about 15 minutes left. I'm going to go back to our speakers, and this will be for those of you who listen to Wait, Don't Tell Me as I do. This will be like the lightning round where we're going to ask people a question and they only have like a minute to give a response, but it'll be meaningful for sure. So Maybe Cindy, will start with you. And, you know, we've talked a lot about some of the different things related to families and care partners in nursing homes, but can you think of one thing, any one thing that you've done to support another nursing home family member, somebody else who's been a family member or care partner that you've interacted with? What would you say?
A lot of our family members have jobs and can't be here during the day. I give out my phone number to these family members. Say our Wi-Fi is down and they have a camera in their mom's room. They'll give me a call to find out if it's the Wi-Fi that's down or if the camera is broken, and I'll let them know. They also want to know, did you see my mom eat today? How much did she eat? And I'm so happy to do that. And it's just a natural thing that a lot of our resident families do. They give each other their phone numbers too, and they keep an eye on the family members when somebody can't be here, when they go on vacation. You know, they want somebody with ears and eyes that can keep an eye on their family members. So it's something that people are happy to do, and that's how we foster relationships with family members and with the residents as well. You let me know if there's something going on that you don't really, I mean, I've had people say, I don't want to tell my daughter what's going on. And I'm like, well, you tell me what's going on and I'll make sure that it gets taken care of. And so you need to foster those relationships.
Yes, absolutely. That's a great example. Jeanette, how about you? Something you've done for other families?
I'm very similar. In particular, even now, the lady across my room is the only room in the building where you can actually sit in my room and see into another room. The way they're all angled, I don't know if it's because I'm in the end room of this hallway, but the lady across the hall, I do keep an eye on her, and her daughter will check with me. She comes for dinner every night. She'll say, did my mom eat today? What time did she get out of bed? That kind of thing. So I do that as well on several others. And even with my other family members in the building, I've given my number as well, and they'll contact me or thank me. Same kind of thing that Cindy's doing. We're neighbors. I sing, it's a beautiful day in the neighborhood, you know, because, you know, especially when people are acting out a little bit, it kind of makes them laugh and chuckle, and they realize they're kind of being really silly. But it's a neighborhood, and you've got to be kind and be nice to know your neighbors. So
that's right. I think we're going to have to send you guys all those little red cardigans that Mr. Rogers wore when you you'll have that for when you say that. Carrie, I'm going to ask you a slightly different question because you actually already gave us the answer to what I asked these guys earlier. What's the one thing that the nursing home has done to make your life easier as a family member? What's just one thing that they've done that, besides the award that you already mentioned, but is there one other example that you can think of that the nursing home did?
That they stopped dismissing me. They learned to listen, and to, especially when we have new nurses, to educate them that I'm not crazy. I'm really not. There's a reason I am who I am. You know, unfortunately, my son is one of the most complicated people they have in their building. You know, our DON tells people the minute you are comfortable with him, he's going to fool you and it's going to bite you in the butt every time. So getting them to understand that I wasn't always overreacting, and that, you know, because sometimes it's hard to listen to a loved one's gut instinct. But, you know, in the end, our gut instinct tells us a lot.
They do. And we hear that a lot from people, for sure. There's one last question that I think we'll go around to our speakers again, lightning round, and then we're going to open it up for everybody, because this is really the focus of what we wanted to have in this conversation today, which has been a fantastic one. And the question is, you know, what is the one thing that nursing home teams could do going forward that would make relationships with family members easier. Just, if you could go back to the nursing home, and we already saw a couple of examples of people who already took action on this call, but what's the one thing that you would say to a nursing home team, anybody on the team, that they could do that would make it easier for you? Maybe Carrie, we'll start with you. Go ahead.
Introduce yourself.
Mm-hmm.
It's such a simple thing, whether it is the family member to the team member or vice versa. But, don't just walk in a room and knock, say housekeeping, come and pick up the garbage and go. If there's a family member in there who you do not know, introduce yourself.
Right. And it's such a simple thing, but it's one of those things, it doesn't cost anything. It's not a multi-million-dollar initiative, right? So, and again, I know, looking around at this call, I know a number of you who are working in nursing homes and running nursing homes, you think about these things. So those small things matter. It's part of culture change. It's part of thinking about the person at the center of everything, as Marie said earlier. Cindy, how about you? What would you say would be the one thing you would recommend that would make it easier for families?
Definitely improve on communication. When something is not going right for your loved one, you just need to communicate it to a staff member, and vice versa. Open communication, not accusing, not being negative, trying to come up with a solution. We're all about solutions, okay? We're not attacking, we're trying not to attack, but try to put yourself in a resident's shoes. We come into a nursing home, we lose all control. We're told when to get up, when to take your shower, and you don't have any control. So try to put yourself in that person's shoes, and just for a day, try to feel what that person must feel like, so that you can develop more empathy for each other, and also have empathy for our caregivers, because during the pandemic, they suffered a lot also, having to take care of people that may have died, knowing that, that they risk being heartbroken as well as a family member over losing someone. So we have to have empathy and good communication.
Well said. We hear that a lot. We can't hear it often enough. So thank you for that. And Jeanette.
My comment was that I think every person on the planet wants to be valued and heard. And that does not change when somebody lives or moves into a nursing home. And just because they've become ill or disabled or not able to function in the full capacity that they did at one time does not diminish the fact that they still have rights, and you should be able to say when you want to go to bed and when you want to get up and when you'd like your shower. It should not be what is convenient for them. They should be looking at good customer service and when it's convenient for you. Is there a line where you have to become flexible and maybe sympathetic on like the staffing situation for the day and be willing to bend here and there? Yes, but you should, just because you live in a nursing home, not have a fulfilled life in the best way that you possibly can. And that's one thing that.
Oh, did she freeze? Yeah, she might come back.
In their nursing home. And I would encourage all other people living in nursing homes to do the same thing. Encourage others to become who they really are and have the nursing home work with you so that you can pursue those dreams or things. We recently had two gentlemen. We used to have a we here, and somebody during the pandemic, it got stolen. And so they just recently had mentioned that they missed that. And they really would like that. Well, our facility heard that. And within a week, we had the we replaced, a television set up in an area where large people could gather, and they have been using it every day. So they feel very valued, they feel very heard. And just one small example of that.
All right, that is an absolutely great point to help wrap us up here. I chatted in just 2 links, as I said at the beginning. We always put in a few upcoming events. Transformation Tuesdays, Michelle Arnott has been on this call. If that link doesn't work for whatever reason, you can go to the website for Gray Panthers NYC and you can sign up. And also NCOA, just, let us know early in May is Mental Health Awareness Day. So just to possibly related topics and events for you to consider. Before we wrap, I want to ask Sumire and Isaac, our director and our associate director, do you guys have anything to add to this conversation? Anything we didn't cover that you thought you wanted to help us wrap up with?
Thanks. I see. Yeah. Thanks, Isaac. No, I just wanted to thank the speakers again. This was such a powerful conversation. I know someone had asked that, ask about the recording. I believe we'll be sending it out to everyone who's registered. And I think it'll be on our YouTube channel too, which I can chat in.
Isaac, you get the last word.
I just think this is such an important topic. We talk about making nursing homes homes in a lot of ways. One of the things the coalition talks a lot about is the physical environment of nursing homes, right? We want nursing homes to be built like homes where people have privacy and space for dignity. Family is also, for so many of us, a really important part of what it means to have a home. And I would argue maybe even more important than the physical environment for a lot of us. It's a really complicated word, family, right? It means different things for everyone. It's very culturally rooted. It's very dependent on who you are, where you are. And I just think that it's so important that nursing homes think about how are they embracing and making space for family. And so I'm so glad we've had Carrie, Cindy, and Jeanette here to talk about their very diverse experiences of family. They're all mothers, and we are just so grateful for the motherhood you provide in your nursing homes and for our community in the fullest possible sense of that. So thank you.
Thank you.
Wonderful. Thank you all so much, and keep in touch. We need our advocacy. We need it together. So we appreciate you, and have a great rest of your day, rest of your week. Thank you.
Thank you.
Thank you.
I am so glad. Can I do it? Yeah.